Hello, welcome everybody. This is Dr. Bolad, board certified physician in cardiology, interventional cardiology, and internal medicine. I'm here to help you with all the information you need for your heart health and general health, and informing you about all the latest treatments in cardiology and medicine. If you are new to this channel, then definitely consider hitting the subscribe button below and switch on the notification bell so you don't miss any new video that I post. For my international viewers outside the United States, you can get translated subtitles of this video by pressing the closed caption CC button on the upper right part of your mobile device screen and selecting your preferred language from the settings. Side effects of the mRNA COVID-19 vaccines have been reported by the manufacturers to occur more commonly after the second booster dose. This is because the body has already developed some antibodies from the first dose. I got my first dose of the Moderna COVID-19 vaccine in the third week of December. I had absolutely no side effects from the first dose. I could not even feel the needle injection site. 4 weeks later, which was 5 days ago, from the recording of this video, I got my second booster COVID-19 vaccine dose. The experience was quite different. Literally 6 hours after getting the second vaccine dose, I started to get significant pain in my left upper arm, and that progressed very rapidly within the next few hours to the extent that I could not move my whole left arm, and I developed muscle aches all over my body. At the same time, I started to have chills and shivers and had a temperature of 38.1 Celsius, which is equivalent to 100.5 Fahrenheit. For the following 24 hours, I was in a bad shape, not able to move at all, not even able to reach out to the phone next to my bed to ask my family members to bring me water, as I felt dehydrated from the sweating. Eventually, I improved by using painkillers and by hydration. And now, 5 days after the second injection, I feel better, but still not back to normal. Still having left upper pain and fatigue. The first question that came to my mind during the first 24 hours of my ordeal was, how do the elderly, frail population who are currently the top priority for vaccination survive the second dose of this vaccine? This prompted me to research the subject, the results of which I share with you in this video. A number of elderly patients across Europe died after receiving the COVID-19 vaccine. In January 2021, the Norwegian Medicines Agency reported 23 deaths potentially linked to the Pfizer vaccine, followed a few days later by a report of 20 serious side effects. As of January 19th, there were reports of 71 deaths linked to the Pfizer vaccine across Europe, with 16 in the UK and 12 in Germany. These fatalities occurred in elderly patients with comorbid conditions, with about 35% of the people who died were 90 years old and over, 46% were 80 years old and over, and all were over the age of 70 years. The questions that arise are these deaths really related to the vaccine? And could the second dose of the vaccine cause adverse effects that destabilize these elderly frail patients, leading to death? It is certainly possible, but when I looked at the limited information available, I could not find supporting data, at least not at this time. According to the news reported in the British Medical Journal, the Norwegian Medicines Agency told them, and I quote, "The agency has investigated 13 of the deaths so far and concluded that common adverse reactions to mRNA vaccines, such as fever, nausea, and diarrhea, may have contributed to fatal outcomes in some of the frail patients." Here in the United States, there have been reports of deaths in the elderly following COVID-19 vaccination. Baseball Hall of Famer Hank Aaron, at the age of 86, had his COVID-19 vaccination on January the 5th of 2021. Here is his Twitter post of the vaccination encouraging others to do the same. On January 22nd, 13 days after his vaccination, he passed away. At this time of recording of this video, I do not have medical information about the cause of death. Obviously, this is causing a high degree of uncomfort and concern among the healthcare professionals, as there is worry that this might cause individuals, especially elderly people, not to accept vaccination. Another death in the United States occurred in a 56-year-old physician in Miami Beach in Florida who died on January 3rd, 2021, about 13 days after receiving the Pfizer COVID-19 vaccine. Here is a Facebook post about the incident posted by his wife. He was healthy and he developed petechial hemorrhage in his feet and hands 3 days after vaccination. Petechial hemorrhages are small bleeding spots as shown here. When he was checked at the hospital, his blood platelet levels were 0. Platelets control bleeding, and in normal individuals, the level ranges from 150,000 to 400,000 per microliter of blood. He was diagnosed to have suffered from idiopathic thrombocytopenic purpura, a reaction to vaccination in general. Attempts to raise his platelet levels failed, and eventually he bled into the brain, leading to his death. This is a very unfortunate and rare side effect of vaccination in general, not specifically related to COVID-19 vaccination. My take-home message to you is, we risk stratify elderly and frail patients undergoing heart surgery and procedures before accepting to proceed with the surgery, as the stress of the surgery might stress the frail body and lead to death. Some patients are refused surgery based on this increased risk. It is possible that the body's reaction to the COVID-19 vaccination might lead to a stress level in frail bodies, leading to death. At this time, we do not have data to support or refute this theory. However, the risk of not vaccinating our elderly is much higher than the potential risk of death after vaccination. Until we get more information, I personally feel that we should continue vaccinating our elderly and maybe consider a single dose vaccination only in the very frail, as the risk of reactions to the vaccine is much higher after the second booster dose. If you have any question about what I presented to you today, or any medical question in general, then subscribe to my channel and share your question in the comment section below, and I will reply to you. If you have a question that you would not like to share in public, then subscribe to this channel, follow me on Twitter at Dr. Bolad, and send me a Twitter private direct message, and I will reply to you. Please like and share this video with family and friends. This is Dr. Bolad, helping you with your heart health. Thanks for watching, and talk to you soon.